Good evening. My name's Debbie Fitzgerald, and I work as a gynae oncology nurse specialist at Torbay Hospital. I've worked in cancer care for a very long time, in my current role for 25 years, and previously on a ward giving chemotherapy. As I say, my current role is in gynae cancer, and so I'm here primarily to talk to you about the role of prevention of cancers in gynae related to smoking. I'll start by saying that the main thing I want to say tonight is that actually the most important thing is preventing precancerous changes, which is why we all have smear tests. We're not looking for cancer, we're looking for precancerous changes, because those can be treated very easily that will prevent you developing a cancer. Background behind that is in something called HPV, which is human papillomavirus. It's a virus that most of us carry. It's not related to promiscuity, but it is passed on very often through intercourse. And the reason that that is important is that those changes are present for most of us at some point in our lives, but most of us are able to actually clear that virus just with our own immunity. And the link with smoking, it isn't completely understood, but we do feel that people who smoke are unable to clear the virus. And so over a number of years, they will go on to develop a cancer. The other part to that is that we are now immunising young girls, or offering an immunisation to young girls to try and prevent them developing the virus, and we know that is being a big success. Sadly, right at this moment in time, that doesn't mean we no longer need to do smears or not advising about smoking, but it will perhaps in time come to be a great help to us all. The tissues that are involved are what we call mucous membranes, and these actually are in lots of other places. So I think cervical cancer is quite well known. Probably what is lesser well known is the fact that women can develop cancer on what is known as the vulval area. So this is the outside of the vagina, so the skin area. And this also can develop precancerous changes that will lead on to a cancer. The other area is in the anal skin. It also affects head and neck cancers. So the list is endless. And so we know that a lot of cancers now are coming from HPV-related virus infections. So we know, as I say, that people who smoke seems to have an effect on their immunity, and so they're not able to clear the virus away. I think probably what's more well known is the fact that if you inhale tar, which is in cigarettes, that it will affect your blood vessels, so it has effect on heart disease, and it will affect your lungs. So you can actually, I think because people can imagine that, they are more attuned to feeling concerned about lung cancer, but less concerned about these female cancers that I'm describing to you. Heavier and the longer that you smoke for, the greater the risk. As I've said, we're really looking for precancerous changes, but if you do develop a cancer, the other thing we know is that when people have to have a treatment known as radiotherapy, that is less efficient in patients who smoke, and the reason for that is because people who smoke will carry less oxygen in their blood, and the radiotherapy is carried in that way, and so it will affect your treatments when you come to need them. I think that's the main crux of what I want to say. So obviously having regular smears is really important, and I think that is put across to the general public very well. What is less talked about is this need to try and prevent cancers in your cervix, and I think because it's so far away from where your cigarette smoking is, people are able to understand it, but it is a very well researched and definitive thing. It's not a question on that. We know that most of the ladies who go on to develop cancer will have the smokers, and particularly heavy smokers. We also know that if you stop smoking, that actually that will immediately start to improve your chances of getting cancer or the precancerous cells. I think that's all I need to say tonight. I have got another string to my bow, which is as a volunteer with the British Heart Foundation. And as part of that group, I have been to the Houses of Parliament where we were campaigning for a bill to be passed, and this is going to become law, that anyone over the anyone born after 2009 will have to will never be allowed to buy cigarettes legally. This was supported by most of the charities, so that's ASH, which is against smoking and looking at your health, the British Heart Foundation, who are obviously very involved in both heart, dementia and any sort of vascular diseases. So it is well supported that really you should not smoke. Younger people have no excuse because this has been taught in schools and has been public knowledge for a very long time. But I'm afraid the pictures on packets look at lungs, but they don't look at all the other risks to yourselves. Well, obviously the support is through the Stopping Smoking in Torbay, which we don't run, but we do actually, every patient who comes to the clinic is advised to stop smoking, and we always give out information. We've got information in the day room that tells people the risks to particularly these precancerous conditions, and we have leaflets, and they are one of the most popular leaflets, but whether people then take us up on that, but you know, through the Stopping Smoking service run by the council is where we hope people will go. We don't directly have any means of helping people because we're there for a different reason.